Doug Gray. I'm the Executive Director of the Virginia Association of Health Plans. What I wanted to do is review with you the discussion that we've had previously. We've talked about this legislation numerous times over the years and vetted a number of the issues. There's no question that our position has been, and we think the facts show, that ADA is an educational service and it's delivered in an educational environment. Last year, the Faison School, which is our local school, private school that provides these services, testified before the Senate Commerce and Labor Committee that they had 71 students and that 59 of them were fully paid for by local school districts. The reason is that IDEA requires local school districts to provide an appropriate education to all children. They have to get an IEP, and then they create a plan to provide services to them. These services are admittedly uneven across school districts. Some school districts, which are wealthier, provide more services than others. The reality is that if the parents have the resources to sue for inadequate provision, they usually win and get some reasonable accommodations. If they don't get service. And that's one of the biggest problems we have here. We don't have a uniform policy to help all children who need these services. When we've talked about these services in study groups over the last year, we've had numerous presentations and at least 6 hours of testimony, particularly in the Senate, about the different approaches that are being used in the school environment, both private and public. There's been no mention of medically delivered services by medical personnel. We understand that there is a revenue problem here, there's a resource problem here, and that's why we're standing here having this discussion. The challenge with mandated benefits is that they don't apply evenly across the board. The fact is that this mandated benefit would apply to probably somewhere between 16 and 20% of the folks in Virginia. In other words, small businesses would be exempt, 50 and below, and this is mostly due to premium impact. Self-insured entities would be exempt. They do not have to follow state-mandated benefits. So what that leaves behind is somewhere between 50 employees and wherever they stop being fully insured and move to self-insured. So if that line is at 400 employees or so, that's when you begin to move towards being self-insured. Being self-insured means that you pay all the bills out of your own account. There is no risk taken by the health plan. The health plan is just the administrator of your account. That's, they get you access to providers and some discounts, and they administer the benefit. So that's practically how it works. One of the challenges with passing a mandate like this one is you will make some of those businesses seriously consider becoming self-insured sooner at a lower number because they're going to see some of the expense coming. Now others will choose, if this sort of mandate would have passed, to participate in it because there are folks who want to. I mean, there's no question that there are folks who could. The limitations on age to 2 to 6 and the cap each year of up to $35,000 have been topics of great discussion in previous years. There is a federal mental health parity statute. There's been some guidance issued on it on Friday, and we don't entirely understand yet whether you can have a cap on this type of benefit or not. Medical services for autism are a mandated benefit already under state law. And that means that medically necessary services are already mandated. It's in the list of mandated benefits under the biologically based mental illness statute. Another challenge with this bill is that we adopted, as a General Assembly, a principle that if we're going to put this type of burden onto the premium payers in the small business area, or in the small to medium business area, that we would also provide the same services for our own employees at the state health plan. And that's actually in code. It's in the state code. This bill creatively avoids the fiscal impact by delaying that application to a future year, until 2015. The second new language in here that refers to the local governments is there because a fiscal impact statement was issued on Friday that there would be potential costs. So that's why that got moved in. These issues are not easy. I don't want anyone to leave with the impression that we don't understand the challenges facing the families. We have a challenge too, and that challenge is trying to keep insurance affordable for the families and businesses who are struggling to have it. And we stand up here on behalf of our customers. The reality is, if they can afford an extra benefit, it doesn't hurt an insurance company. The reality is, as long as they can afford the policy, we're still in business. But when they can't, we're not. And that's why we stand up on their behalf. And so the rhetoric, I understand, about insurance companies paying their fair share. But the reality is, we don't pay for anything. We collect premiums, and then we pay bills on behalf of our customers. Thanks for the opportunity to comment. I'd be glad to answer any questions. We have a couple of folks from the business community who would like to comment as well.
Good evening. Julia Carlo Hammond on behalf of the National Federation of Independent Business. I represent Virginia's small and independently held companies. Whether it was this particular mandate or any other, I'd be standing here before you opposing them. Virginia businesses want to offer quality health insurance plans. They'd love to offer the catalog plans. Unfortunately, they can't afford to offer them. Virginia ranks third in the nation for the number of mandates that they require upon their businesses. And unfortunately, that makes the health insurance just too expensive. According to a study conducted by the Association of Health Insurance Plans, as many as 1 in 4 individuals are without coverage because of the cost of state health insurance mandates. I would love to say that my members could afford this and any other mandate that comes before you, but unfortunately they can't. And the legislation we passed last year, sponsored by Delegate Nixon on the House side, said that what was good for the goose was good for the gander. If you were going to require these mandates and felt that they were so important that these small plans were going to have to require them, that the state would too. And now this is the first bill to sort of test that legislative policy, which passed unanimously in both bodies. And here we are exempting the state plan out, and they wouldn't be in until 2015. I'd also like to point out that it's not only the state employees, but now you have 2 to 50, the larger companies, so it really is just a small percentage of the population that would be able to fit into this mandate now. And then we're assuming in the future it would be extended, and then it would certainly hit my entire membership. So with that, I ask you to please oppose this legislation.
Delegate Moore.
Just a comment. I read, and I'd like someone else to either confirm or deny this. I read just recently that although we're third in the nation in the number of mandates, I think we rank in the middle as far as cost of health care. And if that's true, I think it's because of the health insurance market that we have. There's more competition and more people offering insurance. But I was amazed at that our cost of providing insurance is near the middle.
I think Doug would know the cost, but I do know that only 40% of Virginia's small businesses can afford to provide it for their employees.
You would what the answer on that?
Yeah.
Mr. Chairman, I would say that the average is what the delegates are referring to. And on average, when you take in large group, self-insured, small group, and the folks in the middle, that's the number they come up with. But the reality is that it's not reflective of the subsection that this mandate would apply to. It's reflective of the overall group across all of those pieces of business.